Hi everyone, I'm Aya, one of the engineers here at Imetric, and today I'm going to be spending some time with you going over the basic clinical training for the ICam. This is intended for anyone who will be capturing the measurement in surgery with the ICam and then exporting that data to a designer or lab to complete the alignment. If you are a lab or a designer interested in learning how to utilize the implant position measurements you get from the ICam for alignment, please continue to watch our advanced clinical training video as well as the lab training video specifically for exocad integration. Since you have now already seen the unboxing video with Dakota and your ICam is all connected, go ahead and press that button on the back, that power button, to turn your ICam on. You will notice that the power button will glow blue, and then if you wave your hand quickly in front, the projector will flash the Imetric logo very quickly before showing a heating up image. The ICam Generation 5 takes about 20 minutes to heat up. The temperature is what the ICam is calibrated to. The ICam undergoes two separate phases of calibration. One with our CEO Horst in Switzerland during manufacturing, and the second is every time the user calibrates it. So the calibration you complete with the ICam recenters the ICam and reminds it of its factory calibration. Allowing the ICam to reach the stable temperature ensures stability and accuracy between the calibration and measurement. When it reaches that stable temperature, you will hear the ICam's internal fans kick in to self-regulate. Because of this, you are able to plug in the ICam ahead of time in another room if you'd prefer, and then transfer it into the operatory right before measurement. You can also keep it plugged in the operatory if you have that space. If you are not able to allow it this time to reach that stable temperature, it is very important that you must measure directly after calibration to ensure that you're in that same temperature window. While we wait for the ICam to heat up, I'm going to cover the proper care instructions of your equipment. The ICam itself, because it has this plastic housing, you're able to wipe it down if anything happens to get on it, since it will be in the sterile field with the patient. When you are wiping it down, avoid the cameras themselves and be mindful to be gentle with the ports as well as that projector in front. The ports here in the back, we just want to make sure that we avoid jamming them, getting anything into them, and just generally taking good care of them. Now, what plugs into the back of that ICam is the cable bundle. The cable bundle, we want to be careful not to drag it along the floor, tightly coil, kink it, and really to avoid rolling carts and chairs over it. I recommend to loosely coil this cord for storage and then place it on a cart or in a cabinet off the floor. The second thing is the calibration plate. You want to avoid touching the front of it at all since it is made of carbon fiber. The front is very delicate and should be kept outside of the sterile field. So we want to make sure that we have it farther away from the patient. You can do your calibration, then come back to your patient by keeping it on a table further away. And we want to avoid wiping the front with any sort of wipes. The biggest thing that we want to avoid is getting any scratches on those major 6 dots and just keeping scratches off of it overall. If you happen to get dust or fingerprints on it, you can use a microfiber cloth, such as the same one you would use for your eyeglasses or sunglasses, to gently remove that. I recommend storing it face down in the white box it came in for storage to protect it. So you can keep that calibration plate and that metal footing right there. The ICam bodies that you will be using are dominoes. When you are cleaning them, should have the screws popped out before cleaning and sterilizing. You can use another slimmer, pointier instrument to pop those out. The screws and ICam bodies themselves, you should use warm water and a soft toothbrush to remove general debris and blood. Then you should sterilize them in the autoclave on a warm setting as normal. Avoid using any wire brushes, an ultrasonic, cold sterilization, or really any harsh chemicals on them. This could potentially wear them down a lot faster than expected and really affect that anodization that has created those carefully calibrated target dots alongside the ICam bodies. Because of this anodization and those carefully calibrated targets, we recommend that the ICam bodies are generally good for 50 uses. That each time it goes to the autoclave, that's what's counted as a use. So you can think about this as about 200 arches if you're doing all on 4 double arches. Once you've done those 50 uses, we recommend visually inspecting each of those ICam bodies, and then that's a good time to check if they're still in good condition or to really place an order for another set of 8 ICam bodies. The ICam refs, which will be used to capture the intraoral scan post-ICam measurement, you should care for and sterilize in the same manner as you would those ICam bodies. Within your workflow, let's give some context of when you will be using the ICam itself. Before you begin surgery, you want to ensure that you capture intraoral scans of each individual arch as well as that bite and occlusion. If you are choosing to use a fiducial marker or a palatal marker as your breadcrumb to align along the way, make sure that this is included in those pre-op scans. Then you will complete your surgery. If you are doing both arches, you will complete the first arch by placing all the implants in that first arch, as well as those MUAs, and then place the ICam bodies onto those MUAs. You will capture the ICam measurement at this point, and once you are done, remove those ICam bodies, those dominoes, and place healing caps, comfort caps, scan bodies, whatever you call them, and you will use those for that post-op intraoral scan. So you could use those ICam refs. You will then suture up, capture that post-op intraoral scan, and you're done. This post-op intraoral scan is necessary to align the implant positions too. When placing the ICam bodies in the patient's mouth, it is very important to place them in a 90-degree angle so that from the front, two faces are visible at all times. This allows the ICam to pick up as many data points as quickly as possible and improves the quality of your data collection. We will now walk through how to set up a project in your Imetric software to complete the ICam calibration and measurement. The first thing that we're going to do is going to click on the iScan 3D software. You will see the iScan 3D icon on your desktop. When you click on that, the software will open and you'll be set to the project setup page. The first thing that we want to do is input our client's name. You'll see that box here at the top. Next to it, you'll see a reference 1 and a reference 2 box as well. Those are not mandatory to fill out when you're setting up your project, but the client box is. The software will not let you proceed if there is not a name there. For the reference boxes, we recommend that some labs that use a lot of different practices or partner with a lot of different practices, this is where they'll indicate the specific dentist's name if they would like to save their data in that format, but you do not have to put anything here. The next thing that we will do is we'll go through and select which implant positions we would like to use. You can do a single arch or both arches. If you do both arches here and select, this will be all saved within one project. They will just be treated as if they are two separate scans. So go ahead and we'll select here. You'll see on the lower arch, we'll select those 4 implant positions, and then this pop-up box will show up to your right. There are 2 things to note for this pop-up box. The first being you're going to want to select the exocad library that coordinates to those implant positions. So for that restoration screw, look at this drop-down, select which you'll be using. If there's ever an implant system that you're using that you do not see in this drop-down, give support a call and we will be happy to add that to your library to make sure that you have that option. The second thing that you'll want to note is the ICam body number. So this is that 8-digit number that coordinates to the specific ICam body set that you'll be using. Now, if you have one set of 8, this does not really matter for the time being, but anytime that you get a replacement set of 8, or if you have an additional set of 8, this is where you'll select to make sure that you're using the correct one for this measurement. You want to make sure that that is the correct one because the ICam otherwise will not pick up which specific set you're using. So those have to be kept in those sets of 8. Once you've selected those and ensured that those are correct for the measurement that you're setting up, go ahead and click Apply to All. Once you've clicked that, we'll go ahead to that upper left and we'll click ICam Bodies. You'll note that there's 2 separate ones if you're doing both arches, but only one if you're doing a single arch. Once you click that, now we're going directly to the calibration. For the calibration, you'll note that there are 2 sides to the screen and what they show. On the right, you see a visualization of what the ICam sees. So this is a combined view of those 4 cameras looking at the calibration plate. So make sure you're pointing it at that. And then on the left, you'll see, I call this kind of the video game because the goal here is to turn that red box fully green. It is also a distance meter. The top of that left side is far and the bottom of that left side is near. You'll see the software prompt too far, too near if you need to adjust, but we want to use that as our indicator of how to calibrate. We'll begin with holding the ICam by both handles about 1.5 feet away from that ICam calibration plate. You want to start with the cameras pointing at that calibration plate almost at a 30-degree angle. So go ahead and hold it there. Now, with both your hands, bring that ICam closer to that calibration plate. You'll hear kind of this video game noise playing, the multiple dings as you get closer, and you'll see all of those green dots complete that box and turn it all the way green. Now, if you are going a little too fast or notice that it skips over and there's still some red blocks within that box, you can easily just back up and then go forward once again. Once you've done the calibration, the software is going to automatically kick you to the measurement component. There's nothing else that you need to click or do to begin your measurement. So you want to make sure that before you've started this, that you've already placed those ICam bodies with that corner, that 90-degree facing forward in all of those implant positions so you can go smoothly from one to the next. Now that you have the measurement component up, it's going to be the same idea with the screens. On the right, you get a visualization of what the ICam sees, and then on the left, you see a diagram of what is going on with the ICam. For the left, we want to make sure that we have that green circle and we're keeping those ICam body visualizations within that green circle, and it has the same too far, too near component to it. We want to start by facing the ICam towards those ICam bodies and seeing as many of those ICam bodies as we possibly can. If you can't see from the camera one of the farther set back ones right now, that's okay, we'll get to it. Once you have all of them in view, you'll notice that they might highlight red or yellow. That means that the ICam sees those ICam bodies, it just does not see enough sides of them yet. So to make sure that we're turning them green, because that's the goal here right now, is to get each of those ICam bodies to turn green in their wireframe. What we'll be able to do is start orbiting the ICam in a half circle around the patient's face. So we're orbiting from ear to ear, and we're making sure that we get multiple sides of each ICam body so that they turn green. The next goal is we do this until A, all of the ICam bodies are green, and B, we have 50 views. You'll be able to see how many views in that upper ribbon where it says ICam bodies, views, and exposure. So once it hits that 50 views, that's what we see as the optimal number to make sure that you have all the proper data collected. Once you've hit that, you can set the ICam down and click anywhere on the screen. When you've clicked on the screen, it's going to back out of that full view, and then it's going to give you a view of where those implant positions are. If you do not see a green check mark after you have where these implant positions are, you'll have that green adapter highlighted and showing. This is just telling the software where exactly those implant positions are and which one coordinates to which implant position. You can click on that green adapter, and we call this adapter labeling, and go around the arch to match what is in the diagram on the lower left. Make sure that you're assigning the proper implant positions to each implant position that was measured to make sure that we have that all correct. Once you have that, we'll click that green check mark, or if it is already highlighted from the beginning, you can go ahead and click that green check mark, and that is going to accept that measurement. Once we've accepted that measurement, we're going to go to the far bottom right to click the floppy disk icon, and that floppy disk icon is going to allow us to save that measurement. We're going to save that measurement, and the software will automatically close itself. Just to show you where that data goes so that you can utilize it later by either sending it to your lab, your designer, or if you are the lab designing where to find this data. You'll go to the Imetric 4D data folder, which is also shortcutted to your desktop, and you'll click on that, open that, and you're able to find the patient folder coordinating to the name you originally input in that project setup. And within that folder, you'll see the same data just saved in 3 different languages. You'll see it in 3Shape, in ExoCAD, and in Imetric. All of these folders host the implant positions, and this is what you're going to use to design. Now that we've walked through the project setup, the calibration, and the measurement, I wanted to share some basic troubleshooting with you to begin, and just to be aware of as you practice your ICam measurement and get ready for your first case. If the ICam is having trouble reading the ICam bodies, turn off any ambient lights, or you can increase that exposure. To increase the exposure or to decrease it, you can click anywhere on the screen mid-measurement and then select the higher or lower arrows next to that exposure in the lower left region diagram. Especially for any of those deeper set implants, you can also use your headlamp and point that light directly into the back of your patient's mouth to have some better light around that implant site. When scanning, you also may see the ICam bodies in purple wireframes compared to the red, yellow, or green. If this persists, exit the measurement and restart. If you continue to see this purple wireframe, it means one of two things. Either A, that the wrong arch has been selected, or that the incorrect set of 8 ICam bodies has been indicated. In this instance, go back to where you had your project set up and double check that the implant position selection in your project is correct in A, the arch, you have the correct arch selected, as well as the correct set of 8 ICam bodies has been selected based on that serial number. I recommend keeping the plastic box that your ICam bodies come in to always have access to that serial number in case of any support assistance, or to have that number written down somewhere accessible to anyone using the ICam in your office. Now that you have seen how to set up a project, calibrate, complete your measurement, and save your data, I feel confident that you will be able to integrate the ICam seamlessly into your digital workflow. If you would like to learn how to complete that alignment of the implant positions, please continue to our advanced training video. As questions or issues arise, please do not hesitate to call our support number at 844-811-4449, extension 2. We're always happy to help you. Thank you, and have a great day.